I'm Mrs. Princey, Associate Professor in Mental Health Nursing. A model is a representation of a concept. Okay, we can say it as a schematic representation of any kind of a theory. Today, I'm going to explain about theories which are explained in terms of the model. So, the topic for discussion here today is the conceptual models. So, we have got the various conceptual models like the existential model, psychoanalytical model, the interpersonal model, as well as the behavioral model, which explains its theory in the schematic representation. Right. So let us move on to the meaning of the conceptual model. A model is a means of organizing the complex body of the knowledge. So we have got a model which is going to explain the linkage between the various theories. So this linkage which is going to explain the various theories is represented in the form of a model which is now called as the conceptual model. Many theories try to explain about the human behavior, the mental health as well as mental illness. So these theories are going to give us the strategies that can be used when we work with the patients in the clinical setup, and no one theory explains completely about the human behavior. Each theory, each concept is different. Theories give their own viewpoint, and such kind of theories that we use in the clinical setup when we deliver the care for the patients. The treatment of mentally ill patient, it mainly depends upon the various theories or philosophies which are given in terms of mental health and mental illness. So we are going to study the various theories like the existential model, the psychoanalytical theory, the behavioral theory, as well as the interpersonal theory. So the first theory is about the existential model. So as the name says, the existential, existing. So it is going to study the phenomena about the present situation rather than concentrating on the past experiences. So whatever is happening in the present scenario, so it is going to study only those phenomena. That model is called as the existential model. So what is the role of the patient and the therapist in the existential model? So here the role of the patient is to understand about his own self, and the role of a therapist is like he is assisting the patient to understand about his feelings and value about his feelings. So that is what is the role of the therapist as well as the patient in the existential model. What is the application to the nursing? What is the application of existential model to the nursing? So here the nursing or the nursing care is centered to make sure to restore the patient's full level of functioning in their life rather than the patient concentrating on his own self-alienation. So that is the application to the nursing. Right. So the next model that we have is the psychoanalytical model. It is the model which is given by the psychologist Sigmund Freud. So according to Sigmund Freud, the psychoanalytical model, if you take, we can classify it as, he has given the dynamic of the personality, the structure of the personality, and about the psychosexual theory of the development. So if you take the personalities, what is the basic assumption of the psychoanalytical theory? So the basic assumptions of the psychoanalytical theory is nothing but the libido. Each and every behavior or each and every human act is based upon an energy which is called as a libido. So libido is the instinctual drive that an individual has to fulfill all the basic needs. So it can be the physiological needs of an individual, like meeting his hunger or thirst, or sexual drives, so or elimination needs. So all these are the basic needs that an individual has to fulfill, and this is driven by an energy called as the libido. So when when there is a tension or when there is a stress to meet all these needs, if it is fulfilled, then the energy or the tension will be released and the person will feel happy, right? Pleasure. So that is the overall view or the assumption of the psychoanalytical theory, wherein the human behavior is mainly driven by the energy called as the libido. Coming to the personality structure, what Sigmund Freud has explained. So he has classified the structure of personality into three. So one is the id, the second one is the ego, and the third type of the personality classified is the superego. So id is the one which is working on the principle of pleasure seeking, ego works on the principle of reality, and superego is the one which is working on the principle of morality. So it is a kind of a personality usually which is seen in the children, wherein the child will exhibit the certain kind of a behavior to meet his needs. Okay, if he wants a particular need to be fulfilled, he needs it that moment itself. So it is the immediate gratification which an individual needs to satisfy. So that is the structure of the personality which is explained by the id. So moving on to the second type, which is the ego. Ego is the one which is working on the principle of reality, which will delay the needs of the id, which will postpone the needs of the id, so that based on the reality principle, based on the real situation, what is happening, whether the need can be fulfilled or it can be delayed. So that is being understood or managed by the ego. So coming to the superego is the one which is working on the principle of morality. So these rules and regulations which is given by the society or which an individual learns from his parents. So all these things will make an individual to develop the conscience to know what is right and what is wrong. So that is the principle of the superego, which is coordinating with the rules and the regulations. Okay, so these are the three types of the personality which Sigmund Freud has explained, and ego is the one which is going to act as a sandwich or a gateway between the id and the super ego. The second aspect what Sigmund Freud has explained is about the level of the personality. So if you take the functioning of the personality, Sigmund Freud has classified the functioning of personality at the three levels. So one is at the unconscious level, the conscious level, as well as the pre-conscious level. So in the conscious level, what are all the things which is happening in the present situation? It can be related to various sensations, the feelings which an individual is undergoing, the thoughts that he is, the thinking. So all these are the things which is happening at the present level, at the conscious level. So we can say that these information can be understood or can brought to the awareness. So that is called as the conscious level of the mind. The pre-conscious level is the one which cannot be brought to the level of awareness, right? So certain things which has happened in the life of a person, okay, memories. So memories are mainly stored in the level of the pre-conscious mind. So whenever certain situation comes, if we want to remember those, we can pull some of the memories which can be brought to the level of conscious, but there are majority of things which an individual doesn't want to remember that will be stored in the pre-conscious level of the mind. So coming to the third level, which is the unconscious level of the mind. So here, what are all the painful events that happened in the life of the person, which he doesn't want to remember? He is using a mechanism called as repression to push all those things to the level of the unconscious mind. So whenever a person is, undergoing any kind of a stress or anxiety, whatever is there in the unconscious level of the mind can come to the conscious personality, and it can disturb the whole personality of a person. So you just simply remember that the We have got three levels of the mind, which is the conscious level, the preconscious level, and the unconscious level, which is helping in the functioning of the personality of an individual. Right, here you can see an image that how the structure of the personality and the levels of the personality is functioning. If you take the id, it is simply working at the unconscious level, and if you take the id and the superego, these two are working at the conscious level and even the unconscious level. Right. So moving on to the next part of what psychoanalytical theory is explaining is about the psychosexual developmental stages. So according to Sigmund Freud, every individual is undergoing or is coming across this developmental stage, which is called as psychosexual development. We have got the oral stage, the anal stage, the phallic stage, latency stage, as well as the genital stage. So at each level of development, we have got some activities or a task that has to be fulfilled. If the tasks are fulfilled, then the individual's personality or milestone will be developed well. Otherwise, later on, an individual may end up with a personality problem. So although these stages are, extends to the whole life of a person, the basic personality, we can say, is usually developed during the first 6 years of the life of the child. So it's very important that during the first 6 years of the life, okay, that the child is met with all the needs and is fulfilling all the milestones appropriately, so that later on he may not develop the, personality which can be a destructive one. Another concept what Sigmund Freud has explained in the psychoanalytical theories about the psychoanalytical process. So here they use the two important techniques. One is the use of free association. The second one is a dream analysis, which is going to explain about the individual. So if you take the free association, especially when a person is having a mental problem or problem with his personality, the therapist will be using these techniques to help the patient to come out of the problem. So we are using a free association here. As the name says, free association, the patient is left free to explore or explain all his thoughts and feelings. So that is called as the free association. So we can say it as verbalization of thoughts and feelings without any conscious screening. So that is called as the free association. So here in this process, the therapist is the one who is going to help out the patient to gain the insight or awareness about his dreams. So what are his thoughts or what are his dreams which are going to explain about his intra-psychic conflicts. So whatever the conflicts that he had, okay, mentally, so all those conflicts will be seen in the form of the dream. So the therapist is the one who is helping the patient to gain the awareness about his intrapsychic conflict. So thereby, once the patient gains the awareness about the intrapsychic conflicts, the patient will be able to analyze, and also the therapist will be using the interpretation to understand about his dream and give him the suggestions or the therapy. So that is about the psychoanalytical theory, wherein you have learned about the structure of the personality, that is ego and superego, the functioning of the personality in terms of the various levels of the mind, that we have the unconscious level, conscious level, and the preconscious level, and also various psychosexual stages of development, what Sigmund Freud has given. And one more thing is about the therapy. So how the psychoanalytical process takes place, mainly by the free association as well as the dream analysis. Moving on to the role of the patient and the therapist in the psychoanalytical model. So what is the role? The patient is the active person here who is going to reveal about all his intrapsychic conflict in terms of his thoughts or feelings to the therapist. What is the role of the therapist? Therapist is the one who is acting as an assistant here, who is going to analyze his thoughts and feelings and is going to communicate to the patient, and thereby the interpretation of his thoughts and feelings is done, and he will act as a shadow person. So that is the role of a therapist. What is the application of psychoanalytical model in nursing? okay, to nursing. We have got the various health professionals. When they come across these patients, they will be able to understand what are the behaviors or thoughts about these kinds of the patient which is distorting their personality. We have got various mental health team professionals who will help the patients to analyze their thoughts and feelings, which will also help the professionals to find out what is the psychopathology and stress behind a particular human behavior. The second thing is it will help the nurse to gain the knowledge about the various human behaviors or the various personality of an individual. Thereby she will be able to understand the different individual when she gives the care. So this is the application to nursing. The next model is the behavioral model. So behavioral model is being explained by the theorists such as the John B. Watson. We have got the theorists who are explaining the learning theory. We have Ivan Pavlov and the Skinner. So these are the theorists who are explaining about the behavioral theory. So what is the basic assumption of the behavioral model? So all behaviors are learned, whether it is adaptive behavior or a maladaptive behavior, all behaviors are learned, and it is happening because of a stimulus. Any response or a behavior happens because of the influence of the stimulus. So that is the basic assumption. The another assumption is the human beings are passive beings, wherein their behavior can be modified or it can be adapted based on the situation. At any point of time, the behavior of an individual can be shaped or changed. So if the person is showing a maladaptive behavior, those behaviors also can be shaped or changed, or those maladaptive behavior can be lessened by teaching the person in terms of the reinforcement. We can give a positive reinforcement for adaptive behavior or a negative reinforcement for a maladaptive behavior. So we can simply say the basic assumption that the behavior can be modified or shaped based on the individual's ability to mold himself. So deviations in the behavioral norm happens when there is undesirable behavior which cannot be adapted. So that is the basic assumption of the behavioral theory. So if you take the techniques, so we have got some techniques which the behavior theorists are, we have got various therapeutic approaches which the behavioral theorist has given. At present, these techniques are used in the treatment settings, right? So some of these techniques are like systematic desensitization, token economy, shaping. We have got the chaining, prompting, flooding, aversion therapy, assertiveness, and social skill training. So these are the techniques which are used to modify the behavior of an individual when it is not acceptable by the society. Moving on to the role of patient as well as the behavioral therapist. So behavioral therapist is here a person who will be able to identify the maladaptive behavior of the patient, and also he will help the patient to modify his maladaptive behavior to adaptable one. The therapist uses the patient's anxiety to modify the behavior or act as a motivation to change the behavior of the patient. The therapist also plays a role in teaching the patient about the behaviors which are not accepted, and also he will help the patient to overcome or make the behavioral hierarchy based on which that he can modify his behavior. The therapist also helps in reinforcing the behavior. So at times when the patient shows the behavior which is accepted, he will give a reinforcement in form of a praise or an appraisal, so that the behavior which is accepted can be followed by the patient. So that was about the role of the therapist in the behavioral therapy. Coming to the role of the patient. Also, the patient is an active member, so he is a learner in the behavioral therapy. Patient here practices the various behavioral techniques to modify his behavior. So that is why he is an active member in the behavioral therapy. he is the one who is going to do the homework. That is what whatever his therapist has told him. He is going to try to modify or learn the new particular behavior which is going to be accepted. He is going to practice the particular behavior whatever is accepted. So this is the role of the learner or the patient in the behavioral therapy. So moving on to the application to nursing. So how the behavioral therapy is helping to the nurses. Nurses usually follow these behavioral techniques in the field of mental health settings. Whenever there is a patient who are across this mental illness or behavioral problem, the nurse is the one who is going to identify these maladaptive behaviors, and she will use the behavioral techniques in bringing about the changes in the behavior of the patient. So modification or making the patient to learn the new behavior by using the behavioral techniques is what the role of a nurse is when it comes to the nursing part. So that is about the behavioral model. The next model is the interpersonal model. This model is explained by Harry S. Sullivan. So this is the model, or he is the originator of the interpersonal theory. So what is the basic assumption of this particular theory? He says that the human being is a social being. So he needs to have an interaction or communication or a relationship with the other people in the environment. So that is what is the basic assumption of the interpersonal theory. Early life experiences, especially the relationship with the mother, plays an important role in the development of the personality in the child. Human development proceeds through the 6 stages of development, which is the infancy, childhood period, juvenile period, pre-adolescence period, and mainly the late and the early adulthood period. So these are the stages of the development in an individual. According to the interpersonal theory, the stage of development, which is the juvenile pre-adolescent period, is the one where it will be a lot of personality related problems or a difficulty that the adolescents will face to various situations, right? So at this point of time, it's very much important that the adolescent is given the care or is given the knowledge about developing the interpersonal relationship in an adaptive way, and also try to correct his behavior which is not accepted. So we will see what is the interpersonal therapeutic process. The process of the interpersonal theory or the model is to identify those behaviors wherein there are the interpersonal issues or problems related to interpersonal relationship, and try to solve those interpersonal relationship problems so that the individual will be able to adapt to different life situations. The therapist here identifies those interpersonal problems and he will re-educate the patient in terms of the modifying his behavior and developing the interpersonal relationship. So the therapy will be terminated once the individual learns or gets the proper education about how to develop the interpersonal relationship with the other people and solve the problems by their own self, which will help him to meet his basic needs. So moving on to the role of the therapist and the patient. The therapist has got a role to make the patient understand or aware about his interpersonal relationship and also educate the patient about how to develop an interpersonal relationship and also maintain it. We will do this by engaging the patient in a good empathizing form as well as by establishing the trustworthy relationship. This is going to encourage the patient to speak, wherein he will be communicating his all his interpersonal related problems, and thereby the therapist will help him out. What is the role of the patient? So patient's role is here nothing but to ventilate or share all his problems which is related to the interpersonal relationship so that he will seek the help or assistance from the therapist. What is the application to nursing? So here the nurses are there when the patients come to the nurse. She has to identify the various problems of the patient. So also she has to counsel the patient, which mainly depends upon developing the interpersonal relationship. So we have to maintain a professional relationship with the patient, so that the patient will be comfortable. He will develop the trust in us so that he will explain or share or ventilate all his feelings to the nurse, wherein the nurse can analyze and try to give the suggestions or therapy to the patient. So that is the application to the nurse. So this is about the various models that are explaining about the development of personality and the behaviors of an individual which a human being will have from the time of the birth till the death. So we can simply say that these theories are going to help out the nurses and the mental health professionals when they give or deliver the care to the mentally ill patients, to modify their behavior and help them out to maintain a relationship which is acceptable by the society. Hope you all have understood the topic. Thank you.